We are Group 2 and today we will talk about the assessment, goal setting, and intervention for CC. Starting with some background information, CC is an 8-year-old and 2-month-old girl studying at a mainstream primary school, in which she was found to only be able to use simple sentences to express herself. To assess CC's language abilities, we have planned to conduct the standardized test Hong Kong Colors and an informal criterion reference test to test her narrative skills. We chose Hong Kong Colors as it is an age-appropriate test for CC. We have selected subtests 1 and 2 to assess her receptive language skills in terms of grammar and passage comprehension. Subtest 1 to assess her expressive syntactic skills and subtest 3 to assess her expressive semantic skills. By comparing the results of her performance in receptive and expressive language subtests, we can identify any existing gaps between the two domains, as according to Paul, the development of receptive language usually precedes that of expressive language. For the informal CRT, in consideration with CC's reported current abilities, we have chosen to conduct a story retelling task. The story we have selected is a 4-picture story, which is a complete episode. CC's retell quality will be analyzed by Appleby's story grammar system in terms of macrostructure, which consists of the story grammar elements, and microstructure such as connectives.
Here comes the result of Hong Kong Colors. According to subtest 1, CC's performance was 0 SD compared with the mean of her same age peers. Her receptive ability was normal. However, it was observed that her expressive grammar ability was not typical compared with her age peers, showing a significant receptive expressive gap. Subtest 2, passage comprehension, and subtest 3, word definition, demonstrated that she had typical development in these areas when compared with her peers. She had most difficulty with expressive syntax. For story retell CRT, CC produced a true narrative with 5 story grammar elements. Complete episode was observed. It is age appropriate for an 8-year-old. Current issue lies in the microstructure of her retell, as she used simple sentences primarily. From Hong Kong Colors and narrative CRT results, further CRT assessments were conducted to thoroughly look into her expressive abilities. From Hong Kong Colors, CC scored 8 out of 18 in expressive grammar subtests, in which she scored 0 out of 6 for passive structure. Since Hong Kong Colors had limited questions assessing the passive structure, further passive structure CRT was conducted to ensure reliability. Here's a clip of CC's Hong Kong Colors passive structure performance.
嗰度門。
我哋試下用比嚟去形容呢幅圖畫。
兩仔壓住道門。
有努力嘗試喎。Since Hong Kong Colors had limited questions assessing connectives, and from the story retell CRT for microstructure, CC did not include any connectives like 因為所以 and 雖然但係. Therefore, further assessments on these 2 connectives were conducted. CC scored 2 out of 8 in passive structure CRT. The items in red were probe items that CC responded incorrectly. Here's a clip of CC's passive CRT performance. A trial of accurate response and a trial with inaccurate response were demonstrated.
男仔俾狗仔追。
有睇清楚圖畫喎。
個妹妹攬住公仔。
有努力試喎。CC achieved 100% accuracy for 因為所以, but only 25% accuracy for 雖然但係. Here's a clip of CC's 雖然但係 CRT performance.
雖然好多功課，跟住佢睇電視。
有俾心機試喎。
雖然佢病咗，但佢冇戴口罩。
It is concluded that CC is diagnosed with DLD with significant breakdown and deficit in expressive syntax.
Now we'll move on to our intervention plan.
The first short-term goal is the spontaneous production of passive voice sentences. For the internal evidence, on Hong Kong Colors, CC scores 0 out of 6 trials on passive voice and 2 out of 8 trials on an informal CRT, which is 2.3 SD below the mean. Her error showed over-reliance on SVO word order.
indicating lack of passive syntax despite intact semantics. Developmentally, passives are acquired by age 5 to 6. At 8 years and 2 months old, CC is 2 to 3 years delayed. With emerging ability and scaffolding strategies, this lies in her ZPD. Functionally, passives are essential for coherent retelling and academic needs. The second short-term goal is using concessive conjunctions, 雖然但係. For the internal evidence, CC scored 25% on the CRT. Errors included omitting 但係 or using 跟住 instead. She grabs the subordinate clause but not a contrastive relationship. In story retell, she omitted all concessive markers despite an implicit contrast. In terms of the age expectation, this target structure is acquired by age 5. CC is 3 years delayed. She has the existing concepts of using causal conjunctions, so concessive conjunctions are in her ZPD. With intervention, her narrative cohesion and academic skills will be benefited.
For the goal on passive sentences, we'll be using EMT as the approach. Several studies, including randomized controlled trials and meta-analysis, have indicated the effectiveness of EMT in supporting language development, which may be helpful in encouraging CC to expand her simple sentences in a more naturalistic manner. The intervention procedures are as follows. The clinician will first introduce the meaning and usage of the passive marker, 北, and provide an example of the sentence by relating it to the client's daily life, as a form of incidental teaching and further demonstrate the function of passive sentences. The activity will be a find the difference game. The clinician will first begin by asking question prompts to further consolidate the client's understanding of passives, as it reverses the typical subject-verb-object order to mark the recipient of an action. 2 pictures will be provided to show a clear visual contrast between the agent and the receiver, as shown in the bottom right, and to provide visual support to make the syntactic difference between the active and passive voices more obvious. CC will be invited to produce the target passive sentences according to the pictures, and the clinician will apply the cueing hierarchy as follows. The objective level will be general question prompt with orthographic cue, along with the clinician's pointing. We will now take a look at the demonstration.
好啦，咁姑娘呢度有2張相喎，我想請 CC 幫我揾下佢哋有啲咩唔一樣，要用比子去講下呢幅圖畫有邊度唔一樣喎。咁姑娘試一次先。呢度有 BB 島寫奶喎，奶俾 BB 島寫咗喎。你幫我揾下仲有冇其他地方唔一樣？呢度發生咩事啊？你試下用比字去講。
貓俾魚捉咗。
係喎，姑娘聽到你有嘗試用比字講喎，但係姑娘聽到呢幅圖畫咁搞笑嘅，我哋試下先。
魚俾貓俾魚捉咗。
邊個捉魚啊？而家
貓
魚俾邊個捉咗啊？
貓
咁你試下用比字去講一次啊！
魚俾貓捉咗。
係啦，咁樣就聽得好清楚啦，係魚被貓捉咗喎。好啦，咁我哋再試下先，你幫我揾下仲有冇咩其他地方唔一樣？
呢度老鼠芝士俾老鼠食咗。
係喎，芝士俾老鼠食咗喎，今次講得好好喎。
It was suggested that CC has started to develop an initial understanding of the target structure, as evidenced by her improved performance during the latter part of the activity, and the objective level will be kept in the next session. As for modifications, the clinician will provide at least 2 practice trials during the task demonstration, and use the prior question prompts before moving on to the actual training, to serve as consolidation and ensure familiarity with the target structure. Moving on to our second session goal, CC will be able to produce concessive conjunctions to describe oppositions under visual and verbal cues within 70% of the trials. We have adopted sentence combining as our intervention approach. External evidence has proved it as an evidence-based approach that targets complex sentence structures and is effective to improve syntactic complexity of school-age children. The approach also fits CC. It is hoped that it can help expand her short and simple sentences. Here are the intervention procedures. First, CC will be introduced to the meaning and usage of 雖然但係 under a visual aid as shown below, with a daily life example provided to consolidate its meaning. The activity planned is a matching game, in which 2 columns of card with respect to 雖然 and 但係 will be placed separately to indicate the antecedent and the unexpected outcome. CC will be invited to flip a card from each column. Once a card is flipped, she will describe it. If necessary, the clinician will provide with a more comprehensive meaning. CC will be asked to judge whether the flipped pair has opposite meaning. This step is to allow CC to understand and judge the semantic relationship carried by this conjunction. Lastly, the clinician will repeat the 2 clauses, and CC will be asked to combine them using 雖然但係. Here is our hearing hierarchy. Our objective level is set under visual and verbal cues. Decreasing and increasing step will be implemented with respect to CC's real-time performance. Here is a role-play demonstrating one trial.
今日我哋會用雖然但係去講圖畫喎。雖然但係咧係形容兩樣相反嘅嘢，結果仲要係估唔到嘅喎。你哋試下先。你會點樣形容呢幅圖畫啊？
有太陽。
係喎，有太陽，天氣好熱喎。你喺呢邊再填多一張啊。係喎。
佢着褸。
哦，係喎，姐姐仲着住褸喎。我哋試下用雖然但係去連埋呢兩幅圖畫啊。
雖然好熱，但係佢仲着褸。
係喎，有用雖然但係去講喎。雖然天氣好熱，但係姐姐仲着住褸喎，講得好好喎。
As the objective was met, increasing step by presenting clauses in a mixed manner will be implemented to facilitate better understanding of the semantic relationship. In order to monitor CC treatment progress and effectiveness, pre-treatment, interim, and post-treatment baseline using a criterion reference probe measuring accuracy of responses will be conducted. Thank you.